Колеги, ми продовжуємо.
Dear colleagues, we continue our working day. The topic of our current briefing is saving Ukrainian private results of the first nationwide hepatitis C test among the 80 fighters. Good morning, dear representatives of the mass media. I am Pavlo Skala, Associate Director for the Policy and Partnership at the International HIV/AIDS Alliance in Ukraine. We have very short press briefing. I would like to invite my colleagues to the microphone. We have Olha Tkachenko, Project Coordinator, and the NGO Yurydichna. Sotnya, Legal 100 volunteer, member of the Medical Committee, the People's Volunteer, Anna Mayboroda. I also invite Strubchevska, Lyubov Mykolaievna, mother of a serviceman. Serhiy, Lytovka, head of the Central Sanitary and Epidemiological Control Office at the Ministry of Defense of Ukraine. I also invite Madam Olga Golubovska, head of the Department of Infectious Diseases at the National Medical University and Chief Specialist of the Ministry of Health. Madam Natalia Nizova, Director of the Ukrainian Center for Control of Socially Dangerous Diseases at the Ministry of Healthcare of Ukraine, and Mr. Jacek, Tyszko, Country Coordinator of the Joint United Nations Program on HIV/AIDS, UNAIDS in Ukraine. We are drastically short of time, and we will speak very briefly on the topic. Tomorrow we have, yesterday we'll have the day of the defenders of motherland, and this is the day when we mention our enemies. There are some obvious enemies and invisible enemies, and during the ceasefire we have time to devote attention to the hidden enemies, invisible enemies, and in this context we mention such infectious diseases as hepatitis C. You have our press releases handy, and it is based on the results of survey and testing which was started on the International Day devoted to C hepatitis, and due to the initiative of the Ministry of Defense we managed to cover 4,367 servicemen in the ATO area. Nobody never carried out such large-scale testing, and currently we have an idea about the general picture and about the level of positive results. So we covered, as I mentioned, 4,367 servicemen in hospitals, in rehabilitation centers, in field hospitals, and the result is 3.6%, but in the hospitals where we have the most heavily wounded servicemen, this indicator is between 5 and 7 positive test results in the central military hospital in Kiev. This result amounted to 10%. This is extremely high indicator, and it signals that we have to do something. So we have at our disposal modern medicines, modern drugs, which could be used to treat those patients. And currently we have defined this new target group, and now we may approach to international donors and ask for additional funding for treatment of the servicemen. In Ukraine, we can treat people with new, absolutely brand new medicine. Since in Ukraine this new medicine is not applied widely, we are able to treat, to cure only limited number of people. That's why, in order to treat a bigger number of servicemen, we need to get additional amounts of this medicine, which is actually rather expensive abroad. And now I invite Madam Olga, who will as Pavel mentioned, we invited a company which carried out an opinion survey and who organized testing. We have selected 4 groups. We carried out testing in the military commissions, field camps, field training camps, hospitals, and so in field training centers, the percentage was at the level of 2%. Among those who visit ATO area more often, the percentage is 4.5. For those who remain in hospitals, now the percentage of the level of infection is 5%. So we see that the infection is progressing. So what is the reason? The servicemen did not. The servicemen who participated in tests, and they proved that they were not subjected to serious medical manipulations. 81% did not have any serious wounds. 92% did not have any blood change. 89% did not undergo any change of tissues or organs, and 92 did not have even stomatological treatment. So what is the main risk factor? 23% mentioned tattoos or piercing when staying in ATO, and 59% of all the tested are married or live in civil a civil couple. my son witnessed that he participated in the activities in ETO area, and there were wounded people, there were killed people, and he was slightly wounded, and very soon he felt unwell, and he was hepatitis C was revealed, diagnosed, and unfortunately treatment is very expensive and we cannot afford them. Hospitals in Vinnytsia and in Lviv provided big assistance and rescued his life. Both me and my husband, we devote our lives to army, and we know how people live in the military field conditions. And I ask all the donor organizations and those who can help, I invite you to help us. And also I would like to give the floor to a representative of the Ministry of Defense. On behalf of the Ministry of Defense, I would like to thank to the international UNAIDS organization and to Ms. Olha Tkachenko, who carried out that medical testing and hepatitis C testing, and who revealed these huge levels of disease. The Ministry of Defense perceived this initiative very positively, because we never carried out such testing in the past. On the other hand, under existent conditions, it was easy to organize testing among adult males who are concentrated on specific territories. We tested people of different age groups, and this allows us to understand the level of infection among different age groups, and this may serve as an indicator of the status of affairs in the country in general. Also, this allowed us to understand where to contribute our specific effort. Hepatitis C could be transmitted via blood, via transplantation, via change of blood, and so we came to conclusion that the major source of infection in the state, this is dangerous behavior. When we started this testing, we had some fears that medical manipulations in the ATO area might be the source of this infection, because we had to deploy military hospitals in very anti-sanitary conditions when the war started. But in result of this testing, we realized that the cases of infection in result of improper medical manipulations are very rare, but the major risk is behavior which creates a risk of infection, not with only hepatitis C, but also with HIV/AIDS. That's why we established cooperation with the International AIDS Alliance and other similar organizations who operate in Ukraine and who are ready to assist the ministry in this work. I invite Ms. Olga Golubovska to the microphone, who's the infections expert from the working for the Ministry of Defense. I would like to thank to the HIV Alliance in Ukraine for its testing. This threatening situation is acute in many countries of the world, but in Eastern Europe, including Ukraine, the situation is becoming critical. And with the beginning of the ATO, we faced this splash of patients of hepatitis C diagnosis, and this year, due to large-scale implementation to the of innovative medicines, innovative drugs to clinical practice, the WHO organization has declared that hepatitis C could be treated successfully, and I believe that assistance from our partners from International HIV Alliance and from our other partners will allow us to continue work in this direction. On the other hand, we have a state program which had been launched 2 years ago, and this program is for those patients who have some diseases and those who have a very serious condition with their livers and other organs, and this allows to keep them with some assistance, while if we want to allow servicemen from the ATO area get access to innovative treatment, we should request for international assistance. By the way, no countries in the world treat their patients free. There are some reimbursement systems, but they are not very big. And what is also very important, prevention. And my colleague, Ms. Natalia, will speak on prevention. On the other hand, we need to have reliable statistical data in order to understand how we may reallocate available medicines, how we may efficiently treat all these patients. Thank you, Olga. Before passing the floor to our final two speakers, speakers, I would like to point out one more slide. These are unexpected results of the testing. This is a dangerous figure. This is dangerous trend showing that 61% of ATO servicemen, they did not use condoms during the last sexual affair, and they did not have constant partners. Since Natalia represents association which deals with infectious, socially dangerous infectious diseases. By the way, condoms are not present in individual first aid kits, and we have just started our negotiations with the Ministry of Defense on this matter. And now I give the floor to Ms. Natalia Nizova, Director of the Center for Social Diseases. Dear colleagues, we speak about the outcomes of the problem, but we should speak about the prevention, and we clearly understand that we need to go to a different level of cooperation. We should establish intra-agency dialogue with the involvement of the Ministry of Social Policy, international organizations, which should promote and campaign for healthy behavior and safe behavior of people. The next aspect of our attention should be infection control. We should pay attention to the conditions in which our servicemen stay at the front line, and also we should pay attention at the conditions in our field hospitals and military hospitals, and we should speed up registration of innovative medicines for treatment of these infectious diseases, and allow free access to treatment for servicemen, for those who stay in those risky conditions. Our final speaker is representative of the UNAIDS in Ukraine, Mr. Jacek Tyszko. Let us look at this from the UN bureaucrat point of view. There is not a unique situation in the country, which there is not a unique situation which we observe. The similar situation could be seen everywhere in the world. The servicemen everywhere in the world, they are under higher risk, under 5-7% higher risk in peaceful relations. Under conditions of military conflict, the risk rises 50%. That is what we should keep in mind. About information of the allies and other organizations working in the ATO area, the ministry's information, the information of the alliance should be carefully studied, and the measures should be taken very quickly. We should take preventive measures very urgently, otherwise the risk will grow up to 50%. The third the Ministry of Defense should take lead in this process. It should take coordination effort and streamline this effort against general civic conditions. Under the auspice of the Ministry of Defense, this could be done very easily. We have more than 50 years of experience with the military in the areas of conflicts, and we know how this could be done quickly. Dear friends, thank you very much. Unfortunately, we do not have time for questions. Dear colleagues, if you have any questions, you may ask them in our lounge, and we invite you to ask questions to the mother, to the experts, those who wish to have who wish to get information. Please let me know. Leave your emails to me. Thank you.